Welcome. In this video, we'll walk through key coding steps for radiology X-ray services, covering CPT codes, imaging views, charts, ICD-10 tips, and common pitfalls to avoid. Let's get started. Let's review the CPT code used to report this service, 73650, Radiologic Examination, Calcaneus, minimum of 2 views. This code applies when at least 2 radiographic views of the heel bone, also called the calcaneus or os calcis, are obtained. The following views are commonly used to evaluate the calcaneus and its supporting structures. Standard views. Axial view, Harris method, evaluates the plantar aspect of the calcaneus, subtalar joint space, and talus. Lateral view, useful for measuring Bowler's angle and visualizing articulation with the cuboid and talus. Orthopedic and trauma views. Lateral axial oblique, shows middle and posterior articulations of the subtalar joint, sinus tarsi, and lateral malleolus. AP axial oblique, Broyden's method, demonstrates the posterior articular facet in complex fractures. Lateral rotation, Broyden's method, shows the subtalar joint and posterior facet articulation with the sustentaculum tali. Lateromedial oblique, Isherwood method, displays anterior subtalar surface and talar articular surface. AP axial oblique Isherwood method highlights the posterior subtalar articulation in profile. Report example, order exam calcaneus 2 views. Header, lateral and axial views of the left calcaneus. History, fracture, left calcaneal ulcer, rule out osteomyelitis. Comparison, 11/20/2022. Findings, lucent appearance of the posterior Achilles soft tissues could reflect ulceration. Alignment of the calcaneal tuberosity fracture and associated hardware is unchanged. 2 metallic objects along the plantar aspect of the calcaneus are also unchanged. No new osseous erosion or periosteal reaction. The posterior tibiotalar joint space is widened. Impression, unchanged alignment of a partially healed calcaneal tuberosity fracture. Possible overlying soft tissue ulceration, without findings specific to osteomyelitis. CPT code selection. Let's look at the views, lateral and axial. That's a total of 2 views. This qualifies for CPT code 73650, left, radiologic examination, calcaneus, minimum of 2 views. Now, let's choose the appropriate diagnosis code based on the clinical history and chart findings. Report findings. State, this is a follow-up study for a partially healed left calcaneal tuberosity fracture. The radiology report mentions no new osseous changes and an unchanged alignment, with no evidence of displacement. A soft tissue ulcer is suspected, but osteomyelitis is not confirmed, so we do not code the ulcer. This qualifies as a routine follow-up imaging encounter, and we must use the 7th character D for subsequent encounters. Fracture coding, displaced versus non-displaced. If the provider does not document displacement status, you code to displaced. Guideline text, paraphrased from ICD-10 CM FY 2024 Guidelines, section IC19.C and fracture rules. A displaced fracture is one in which the bone fragments are not in alignment. A non-displaced fracture is one in which the bone retains its normal alignment despite the break. If the medical record documentation does not specify displaced or non-displaced, the fracture is coded as displaced. The correct codes for this case are CPT 73650, left, radiologic examination, calcaneus, minimum of 2 views, and ICD-10 CM S9 2.042D, displaced, other fracture of the tuberosity of the left calcaneus, subsequent encounter for fracture with routine healing. Thanks for watching. Be sure to check the links in the description for helpful resources and subscribe for more radiology coding content. CPT is a registered trademark of the American Medical Association, AMA. CPT codes are used in this video for educational purposes only and do not reproduce CPT descriptors in full. This video is not a substitute for the AMA CPT Professional Edition or official coding guidelines. Verify all codes with the most current CPT code set and payer policies before claims.